Hi, this is Dr. Lili with My Pocket Pediatrician. I can guarantee you I spend a lot more time explaining to people why they don't need a medication than I do actually writing prescriptions. I feel like I'm constantly explaining that viruses don't need antibiotics, that cough medicine does more harm than good, or that we don't give antidiarrheal medicines to children. If you leave your visit with me with a prescription, that means I really believe that your child needs that medication. However, I know that once you leave, you only have about a 50-50 chance of giving your child that medication correctly, maybe even less. So that's what we're going to talk about today.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.
Medication errors occur at home for a lot of reasons. Parents often don't understand how much they're supposed to give to their child, so dosage-based errors are very common. Parents can easily overdose or underdose their child, both of which can cause problems for the child. In pediatrics, we dosed all medications based on weight. That's why we always weigh your child so that we know that we're giving the correct dose to your child. When any physician writes a prescription, we always write the dose that's supposed to be given right on the bottle. Don't round up the dose or give a little extra hoping that your kid's going to get better faster. And don't underdose because you think medications are toxic and they shouldn't be used. We want to actually give the right dose. It's really important to give it to your child at the right dose, frequency, and for the right duration of time. If you decide to underdose or stop your antibiotics too soon, you may be contributing to bacterial resistance to antibiotics. And if you're trying to treat another condition like asthma or seizures, you may not be giving enough medication to actually heal the child. When I write a prescription for a child, I always put on the child's name, date of birth, weight, what the medication is, what the actual dose should be, how often you're supposed to give it, and for how long. As doctors, we make all these decisions based on scientific studies that were done that show what particular condition needs to be treated and then also how the body metabolizes it. That's where we get into what the dose should be and how frequently it should be given. These studies were all based on scientific evidence so that we can give your child the correct dose for the correct reason and they can get better faster. If your child gets better a few days into the treatment, that doesn't mean you can stop taking the medication. Check out my other video when we're done about why you have to finish your antibiotics. I'll put the link at the end of this video so you can keep watching now. So when you go for your prescription or your over-the-counter medication, you're going to get instructions. This is just some children's acetaminophen here. And when I open it, I have the medication. It says a little bit about it on the bottle. I have my doser, which is a syringe, and then I also have instructions on the back. Read the label, make sure you're giving the child the correct medication for their age and weight, and that this is the correct medication your child should be taking. Never give your child a prescription medication that wasn't prescribed to them or that was prescribed to them for a different time. A lot of times people will save up old antibiotics and then reuse them later. Don't do that. If it's an over-the-counter medication, read the label, make sure it's safe for your child. A lot of medicines aren't supposed to be given to kids under 2. Just take a look and make sure that this medication is appropriate for your child. When I was a kid, one of my favorite memories was getting sick and having to take purple Dimetap, and I would just lick it off the spoon and make sure I got every last drop because it was so delicious. It's one of my favorite memories as a kid, but it's not one I'm going to be passing on to my children. 1, because I don't believe in over-the-counter cough and cold medicines, but 2, I would never give my child medication on a kitchen spoon. When I was getting ready for this video, I went into my kitchen and I just pulled a few different spoons out of the drawer. And you can see here there's a huge variation in size. If a medication says to give a tablespoon or to give a teaspoon, you know, this one's probably a tablespoon and these 2 are probably teaspoons, but there's actually no way to really know what the right dose would be. So a teaspoon is 5 ml, a tablespoon's 15 ml, so a tablespoon's about 3 teaspoons. But if I'm looking at any of these spoons and trying to guess what to use, there's really no rhyme or reason to it. There's no way I know I'm going to give my child the correct dose using a kitchen spoon. So then I went to get a set of measuring spoons to show you guys, and I realized I don't have any. That's because when I cook, I just kind of tend to throw things in there. So I went and got some from my neighbor, and these are cute little hearts. If my cookies come out with a little extra salt, that's no big deal. If my child winds up with a little extra medication, that might be a very big deal. So if you are going to use a spoon, you want to use an actual measuring spoon, and this way you know that you're getting the correct dose. So this is a real teaspoon, this is a real tablespoon, and you know that you're going to be giving your child the right number of milliliters if that's the correct amount to give. So what if your medicine comes with a little cup like this one? Do you know what most parents do when they see a cup? They honestly just take that whole medication, fill it up, and when I ask how much I give, they tell me, well, I gave a cupful. So when I look at this cup here, this has got 20 mLs in it at the top. So it's got different lines for 1 teaspoon up to 4 teaspoons. So if your child was supposed to get 5 mLs, they may be getting 4 times the dose or more when you fill up a little cup like that. So if you're going to use a cup, make sure you're giving the right amount. It's not just half a cup, it's actually looking at the lines and finding out what it should be. If you're not sure, you can ask your pharmacist or doctor, and they may be able to take a little Sharpie and draw a line to the exact line where you should be. Now, what about syringes? The acetaminophen I had came with a little syringe, but when we look at syringes, they also come in different sizes. So this little teeny one is only 1 ml. The one that was in the acetaminophen is 5 mLs, and then this one's 10 mLs. So not all syringes are the same. It is not just giving a syringe full. You actually want to look at the lines, and you can see the milliliters are marked off here, and fill it up to the correct amount. Sometimes you might actually have to use more than one syringe full in a dose. So if you have to give 7.5 mLs and you have a 5 ml syringe, you want to fill it up with 5, give it to your child, and then do another 2.5 and give it to your child for the same dose. Or they might give you a 10 and mark the line off at 7.5. But just make sure you're using the dose correctly and finding out exactly how many milliliters it should be. After all the studies that came out about how many errors in medication dosing were happening at home, the industry is moving more towards just using syringes because they're a lot more accurate than the cups or the teaspoons or anything else. We're also working towards describing all our doses in milliliters only, so that's another movement forward. So in the future, you may only be able to find syringes with your medicine, and you might only have doses described in milliliters. There is something else called a dosing spoon. I wasn't able to find one to show you guys, but that is something they use for older children sometimes. And basically, you pour the medicine into the handle of the spoon. It can be measured, and then you can turn it upside down, and the child can drink it off the spoon. Again, not the best, but you might come across it, and you would want to make sure you actually check the milliliters and give the appropriate dose. What about droppers? So this is some vitamin D I used to give my baby when I was breastfeeding. So when you do droppers, again, it's not a dropper full. You want to actually give to the line that's appropriate or the right number of drops. So 4 drops or up to the line, because these have little tiny markings on them, and you want to make sure you're giving the right dose. There can be a little bit of confusion with the droppers when medication occurs in more than one type. So sometimes there might be an acetaminophen for infants that comes in a dropper form, and then there's the other kind that comes in the syringe. The confusing part is that the droppers are usually more concentrated, and people get mixed up about that because they feel like it's for babies, so it's probably weaker. It's not true. It's just so that you can give the child the same medicine in a lower volume. So just be aware of that. Look at the concentration, look at the dose, and figure out the right dose based on weight. Now, I don't know about you guys, but whenever I had to give my kids medicine, it wasn't them just happily licking a kitchen spoonful of Dimetap. It was a big fight and usually involves some wrestling. If you have a kid that's struggling to take their medicine, I just have a couple of tips and tricks for you. One, if you're trying to squirt the medicine into their mouth, don't put it straight back into their mouth and squirt it down the back of their throat, because you could actually be squirting it directly into their lungs and they could choke or aspirate. What you want to do with it is put it in the side, kind of in a little pouch on the side of the mouth, and that way the baby, you squirt a little bit in, and then the baby or the child can just kind of swallow a little bit. Sometimes your child might need a little bit extra flavoring with the medicine, so you can talk to your pharmacist. They might be able to give you some extra flavors. If you're mixing it with something else, you want to measure the medication accurately and then add a small amount of the mixer. You don't want to put the medicine in a big bowl of applesauce or pudding, where if the child only eats 3 bites, you really don't know how much they got. You can mix it sometimes with things like chocolate syrup to take the taste away. I had one kid who hated everything sweet and didn't want to take his medicine. So what his mom wound up doing was mixing it with a small amount of sour cream and onion dip, and then she would put it on a chip, give the kid the chip, and he would actually take his medicine. So sometimes you have to get creative and figure out what works, but one way or another, you're going to get the right dose of medication into that kid. Just make sure if you're mixing that your mixer is a small amount so that you know that your child got the entire dose. Another trick that worked for us when my son didn't want to take medicine was he had to take amoxicillin for strep throat. I spent about 3 days fighting with him over it, and every time I tried to give it, he was crying. He didn't want to take it. You know, it tastes like bubble gum. It shouldn't have been that bad, but he just did not want that medicine. So what I did was I just got some milk, I added a couple drops of food coloring to it, made some pink milk, put it in the syringe, and gave it to my husband. And because Daddy was doing it, all of a sudden my son wanted to do it, and immediately it was turned around, and he kept asking when he could take his medicine. So I don't know if that would work for you, but it may be something you'd want to try, is if you can make a little kind of fake medicine, but just make sure you don't get them mixed up. Maybe something like that would work too. Obviously, I'm not promoting lying, but my son was just at that age where he wants to do everything Daddy does. So as soon as Daddy did it, he was totally happy to take it himself and kept asking for it. Just a couple of final tips. In pediatrics, giving your child the correct dose can be critically important. Remember to always use the dosing device that comes with your child's medication. If it didn't come with one, ask your doctor or pharmacist for an appropriate device. It's always best if the medication can be measured in a syringe with milliliters marked on it. Don't mix and match the cups from different medicines because there might be residues. So don't take the cup off the diphenhydramine and put it on the acetaminophen because you might have residues of one medication you don't want to give your child there. Keep all medications locked up and away from children. Just check in with any of my kids. Child-proof caps really aren't child-proof. So you want to make sure that medications are locked away and secure. I have another video coming out soon about medication safety, so make sure you stay tuned for that one too. I hope this segment on giving medication safely was helpful. I hope your child feels better soon and doesn't need to take that medication for long. I'd love to hear any tips or tricks you have to get your child to take medicine. I know a lot of us moms are pretty creative. And your trick may be able to help another parent out. Don't forget to hit that little red subscribe button down there so you don't miss out on any new content. This is Dr. Lili with My Pocket Pediatrician. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.